I regard communication as one of the most important human traits, and I believe from Dr. Liebenberg that communication has been going on in our bodies for centuries. Dr. Liebenberg did undergraduate studies at the University of the Free State and specialized as a psychiatrist, and is presently practicing in Namibia after stints in Botswana and South Africa. Welcome, Reiki.
Hello, thank you very much. Nice to be here.
Reiki, you hinted at communication inside of the body between the gut and the brain. Do I understand you correctly?
That is correct. It's a topic that's very, I'm not going to call it trendy, but it's very topical at the moment, because as we understand it, all the organs in the body communicate with each other. You can't isolate one organ and think that functions independently from another organ. So, but there's a special communication between the brain and the gut. And this has become more prominent in research in later years. So what we know is that the brain and the gut has a bidirectional communication. And it's connected through various factors. It's neurological factors, neurotransmitters, also hormonal factors, and also immune factors. All of these systems are connected. So what happens in your brain will affect your gut, and what happens in your gut will affect the brain. So we talk about the microbiome. It sounds like a very fancy word, but it just means the environment that the gut functions. And what we know is that if the gut doesn't function well, if there's an imbalance in the gut, that there's a higher incidence of anxiety and depression specifically. We don't have a lot of research on it yet, but there's more and more research coming along, which seems to show that if people have an imbalance in the gut and the gut environment, then the brain is also dysregulated. And this is partly due to inflammation. We know that a gut that is imbalanced increases inflammation. And inflammation is one of the main causes of mental illness. So if we look at probiotics, for instance, which we can take in oral form, like lactobacillus and also bifidobacterium, then we find that it will improve anxiety and depression. It will improve the mental state of people who suffer from anxiety and depression. So it's a very important concept that the mind and brain is connected. And this starts from a very young age, that we have to look after our gut and our brain because they communicate with each other. So important to know that the gut microbiome, which means that there are bacteria and fungi and viruses and yeasts and all sorts of colonization of the gut. And it's important that it is as diverse as possible. The more diverse the gut, the healthier the gut and the brain will be.
Reiki, if you refer to imbalance, is that what you refer to?
Yeah, it is an imbalance where you have then an overgrowth of the unhealthy or the more pathological bacteria in the gut will then overpower the healthy gut bacteria.
It all boils down to germs, in other words.
Yes, we need healthy germs in our body. If we have the right concentration of healthy germs in our body, we are better. We are healthier in all regards, and inflammation is reduced. So there's an interesting statistic. There are trillions of bacteria, yeasts, viruses, and fungi, at least as many as all the other number of cells in our body together. And it weighs about 4 pounds. So it's a huge colony of, I suppose, infiltration of our gut that helps us be healthy. If we disturb this, or if anything disturbs the colonization of the gut or the balance in the gut, we get sick. And that could be in many ways, including mental health, anxiety, and depression. Anywhere where there's an increase in inflammation can be affected by a disturbance in the gut. So if we change our diet, if we take antibiotics, if there's another reason, and I'm thinking specifically of stress as to that will influence our environment, it will influence our gut. And then we get sick, we get out of balance. So 50 to 70% of people with irritable bowel syndrome, for instance, have other psychiatric illnesses as well, mostly anxiety and depression. So people who complain of an irritable gut or pain in the gut or diarrhea or reflux or heartburn, you have to look at the whole composition of the microbiome and try and restore that, and probably better to prevent the whole thing from becoming imbalanced if we can.
Can you enlighten us a bit? I imagine if somebody has depression or some similar problem, how will he or she know that it has a gut origin or some other, say, genetic origin? If I specifically talk to people with anxiety and depression, I mention lifestyle factors. So apart from just giving medication, we will talk about regular exercise, about good sleep hygiene and good sleeping habits, getting enough sleep. Also, I talk a lot about diet and what we need to eat to be better. So we know that omega-3 is essential. And this is something I advised for all my depressed and anxious anxiety patients. I also like them to take folic acid, which is a building block in the brain. But there are other fermented foods. If you look at yogurts with active cultures, you look at kefir, you look at sauerkraut, you look at kimchi, kombucha, all of those are fermented foods. There are also what we call probiotics. Those would be, for instance, lots of fiber-rich foods and vegetables, healthy, real food, in other words, not processed foods. Also artichokes, leeks, onions, garlic, olives, and other polyphenols like nuts and seeds. Coffee is actually not bad for the gut. Dark chocolate isn't bad for the gut. And a little bit of red wine, but please note it would be like 1 glass or half a glass of red wine. I'm not advocating huge dosages of alcohol. That's really bad. And then less processed foods, less emulsifiers, less sweeteners. We don't need those in our diet. Also, I talk about exercise. Exercise is hugely helpful in reducing inflammation and helping with growth in the brain and gut health as well. Reiki, you've spoken about two-way communication. Can, shall we say, problems in the brain cause gut problems?
Yeah, that's what I meant when I said there's a comorbidity of 50 to 7%. So if the brain is not happy and imbalanced and inflamed, so people already have anxiety and depression, the incidence of things like irritable gut syndrome and other stress-related gut illnesses like reflux and heartburn and ulcers are increased. So if you treat one, you treat the other. If you treat the brain, the gut gets better. If you treat the gut, the brain gets better. Prevention is still better than trying to cure it, however, because once somebody has developed irritable bowel syndrome, it's a difficult thing to treat and it can take a long time.
Well, you speak about things that usually occur in adults. Is it something that starts earlier, gut problems or depression?
Yes. If you talk about gut health, it's important to note that when a baby is born through cesarean section, the gut is not colonized in the same way as a baby born normally through vaginal birth, because when the baby passes through the birth canal, it's already colonized with some of the microbial the germs basically that the mother already has, and those are healthy germs. So a baby born normally, and that's also breastfed, has a much more diverse microbiome, and they're more likely to be healthy with a better immune system and less likelihood of falling ill. But the other important factor is that children who suffer adverse events in childhood, and now I'm talking abuse, whether it's physical, sexual abuse, or neglect, or poor diet, they have a less diverse microbiome and a much increased incidence of anxiety, depression, and other health problems later on. So what happens to a child from the moment it's born throughout childhood is very important to know that it impacts their health in adulthood as well.
Reiki, do you have any advice for children or babies? Obviously, a lot of babies are born via or delivered via cesarean section these days. Is there anything to do later on? I mean, you can't go back and
No, and it's true that this cesarean sections are quite common, and it's sometimes necessary. I mean, I'm not saying that all babies have to be born in the old-fashioned way at home or whatever, but you can create a system at home where there is diversity. Having pets, for instance, can help stimulate a diverse microbiome. Also, just allowing them to play outside, to get dirty, to play with various things, and then their diet. You have to be careful with sugar, processed foods, especially sugar, and especially with processed foods, because a lot of the stuff we buy, if you look at baby food and whatever, you have to check what you're giving your child and probably try and feed them in the same way you would feed yourself. In other words, home-cooked food as close to natural and whole food that you can get, and make it a very diverse diet. A dietitian once said to me, you need a rainbow on your plate to eat healthily. So you need protein, you need carbohydrates in a certain amount, but you also need lots of fresh fruit and vegetables, as fresh as you can get, which is a problem in our modern society as well, because you don't know what you're buying from the shelf. When you're living in a city and you buy, I suppose, food that's been on the shelf or in a cold room for a while, but you do the best you can.
In your experience, do you see children with psychiatric problems, depression?
There are lots of children with depression. I'm not a child psychiatrist, so it's a very, very super specialized field. So I try not to see children younger than a certain age. But what I do see is adults who've had adverse childhood experiences, who've been neglected or maltreated, and they have a much bigger, up to 4 to 6 times higher than the normal population incidence of anxiety and depression. And they also, in many cases, have irritable bowel syndrome. They almost always have reflux and heartburn and abdominal pain. And they'll go to doctor after doctor and not find any answer for their problems.
Are you saying that if I change my diet, that I will, say, within days or weeks, treat my depression as well?
I don't know about treating your depression. I think you could improve your depression.
Improving is a better word, yeah.
Prove it, and also that it's not going to be weeks to months, because it didn't develop in weeks to months. It's been developing over years. So this is a process of slow and steady change and improvement in diet, and it will improve. In combination with other lifestyle factors, it will improve anxiety and depression. It'll make your brain healthier and better.
You said nothing about beer.
No, beer's not on the list, sorry.
Okay, but obviously exercise, you said, is, which most children have no problem with, but what do you regard as sufficient exercise for an adult?
Well, for an adult, it's the minimum amount that's beneficial to the brain and will improve brain growth and health is 150 minutes per week at 70% of your maximum heart rate. So that is 220 minus your age. So obviously the younger you are, the higher your heart rate needs to go to produce the necessary growth factors. So it needs to be sweaty exercise. You need to run or walk fast or cycle or do high intensity exercise, but something that brings your heart rate up. Taking into consideration other medical conditions. I mean, you can't exercise without checking that you're okay to do so if you've had a heart attack or something. But exercise, very beneficial. Good sleep habits. You need to sleep 7 to 8 hours to make sure you have enough deep sleep for your brain to improve. And if your brain improves, the gut symptoms will also improve.
Well, you've given us some hope. Reiki, would you like to conclude with a few remarks?
If I can summarize, it's important to know that you have to treat yourself or your children or your family as a whole. It needs to be a holistic approach. So it's not just medication or taking a Rennies if you have heartburn. You have to make sure that your diet is healthier and more diverse. Eat the right kinds of foods, stay away from processed foods, make sure you sleep well, make sure you exercise regularly. If you need medication, consult with your doctor and make sure that it's not something that's harmful to your gut. If you need to take antibiotics, be aware that it might disrupt this whole system and you might have to take measures to improve it afterwards. It's also important to understand that sometimes medication like antidepressants or other medication is necessary for you to be better. If you can improve your lifestyle over the long term, it might be possible to come off that medication. But if it needs treatment, it needs to be treated.
Well, at least you've given us a start. We can do the diet and the exercise thing at home before we go and see a doctor. Dr. Reiki Liebenberg, thank you very much for your advice and for the hope that you've given us, and we hope to speak to you soon again.